Blood pressure is the force that a person's blood exerts against the walls of their blood vessels. Then, what is hypertension? It's simply the rising of blood pressure. Hypertension is quite common. Hypertension typically develops over the course of several years. Usually, you don't notice any symptoms. But even without symptoms, high blood pressure can cause damage to your blood vessels and organs, especially the brain, heart, eyes, and kidneys. Early detection is important. Regular blood pressure readings can help you and your doctor notice any changes. If your blood pressure is elevated, your doctor may have you check your blood pressure over a few weeks to see if the number stays elevated or falls back to normal levels. What are the causes of hypertension? The most common causes of hypertension include smoking, obesity or being overweight, diabetes, having a sedentary lifestyle, lack of physical activity, high salt or alcohol intake levels, insufficient consumption of calcium, potassium or magnesium, a deficiency in vitamin D, stress, aging, chronic kidney disease, and adrenal and thyroid conditions or tumors. Some individuals may also be genetically predisposed to hypertension. Blood pressure is written as two numbers. The first, or systolic number, represents the pressure in blood vessels when the heart contracts or beats. The second, diastolic number, represents the pressure in the vessels when the heart rests between the beats. Hypertension is diagnosed if when it is measured on two different days. The systolic blood pressure readings on both days is greater than or equal to 140 millimeters of mercury, and or the diastolic blood pressure readings on both days is greater than or equal to 90 millimeters of mercury, and is considered severe if the pressure is above 180/120. How do healthcare professionals measure my blood pressure? First, a healthcare professional wraps an inflatable cuff around your arm. The healthcare professional then inflates the cuff, which gently tightens on your arm. The cuff has a gauge on it that will measure your blood pressure. How you can ensure that your measurement is correct? Don't drink a caffeinated beverage or smoke during the 30 minutes before the test. Sit quietly for 5 minutes before the test begins. During the measurement, sit in a chair with your feet on the floor and your arm supported so your elbow is at about heart level. The inflatable part of the cuff should completely cover at least 80% of your upper arm, and the cuff should be placed on bare skin, not over a shirt. Don't talk during the measurement. Have your blood pressure measured twice with a brief break in between. If the readings are different by 5 points or more, have it done a third time. Because blood pressure varies throughout the day, your doctor will rarely diagnose the hypertension on the basis of a single reading. Instead, he or she will want to confirm the measurements on at least 2 occasions, usually within a few weeks of one another. The exception to this rule is if you have a blood pressure reading of 180/110 mmHg or higher. A result this high usually calls for a prompt treatment. It's also a good idea to have your blood pressure measured in both arms at least once. Since the reading in one arm, usually the right, may be higher than that in the left. What are the common symptoms of hypertension? Hypertension is called a silent killer. Most people with hypertension are unaware of the problem because it may have no warning signs or symptoms. For this reason, it is essential that blood pressure is measured regularly. When symptoms do occur, they can include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, and buzzing in the ears. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. The only way to detect hypertension is to have a health professional measure blood pressure. Having blood pressure measured is quick and painless. Individuals can also measure their own blood pressure using automated devices. However, an evaluation by a health professional is important for assessment of risk and associated conditions. Home remedies for high blood pressure. Healthy lifestyle changes can help you control the factors that cause hypertension. Here are some of the most common home remedies. Developing a healthy diet. A heart-healthy diet is vital for helping to reduce high blood pressure. It's also important for managing hypertension that is under control and reducing the risk of complications. These complications include heart disease, stroke, and heart attack. A heart-healthy diet emphasizes foods that include fruits, vegetables, whole grains, lean proteins like fish. Eat less meat, more plants. A plant-based diet is an easy way to increase fiber and reduce the amount of sodium and unhealthy saturated and trans fat you take in from dairy foods and meat. Increase the number of fruits, vegetables, leafy greens and whole grains you are eating. Instead of red meat, opt for healthier lean proteins like fish, poultry or tofu. Use dietary sodium. People with hypertension and those with an increased risk for heart disease may need to keep their daily sodium intake between 1500 mg and 2300 mg per day. The best way to reduce sodium is to cook fresh foods more often. Avoid eating restaurant food or pre-packaged foods which are often very high in sodium. Cut back on sweets. Sugary foods and beverages contain empty calories but don't have any nutritional content. If you want something sweet, try eating fresh fruit or small amounts of dark chocolate that haven't been sweetened as much with sugar. Studies trusted sources suggest regularly eating dark chocolate may reduce blood pressure. Increasing physical activity. Reaching a healthy weight should include being more physically active. In addition to helping you shed pounds, exercise can help reduce stress, lower blood pressure naturally, and strengthen your cardiovascular system. Aim to get 150 minutes of moderate physical activity each week. That's about 30 minutes 5 times per week. Reaching a healthy weight. If you are overweight or obese, losing weight through a healthy diet and increased physical activity can help lower your blood pressure. Managing stress. Exercise is a great way to manage stress. Other activities can also be helpful. These include meditation, deep breathing, massage, muscle relaxation, yoga or tai chi. These are all proven stress reducing techniques. Getting adequate sleep can also help to reduce stress levels. Adopting a cleaner lifestyle. If you are a smoker, try to quit. The chemicals in tobacco smoke damage the body's tissues and harden blood vessel walls. If you regularly consume too much alcohol or have an alcohol dependency, seek help to reduce the amount you drink or stop altogether. Alcohol can raise blood pressure. Monitor your blood pressure regularly. The best way to prevent complications and avoid problems is to catch hypertension early. You can come into your doctor's office for a blood pressure reading, or your doctor may ask you to purchase a blood pressure cuff and take readings at home. Keep a log of your blood pressure readings and take it to your regular doctor appointments. This can help your doctor see any possible problems before the condition advances. Thank you all.